There are some things getting done, including a bipartisan effort to protect those who have been abused from being victimized again. We talked about that with former Secretary of State, now State Senator Ruth Johnson. Senator, there are a lot of things that are going on in the Capitol, but one that caught my attention was an effort that you had already been working on as Secretary of State with then senators over in that chamber, now that you're serving in the Senate. And it's an effort to take people who have been victimized, who have been in domestic abuse situations or abuse situations, and giving them the ability to remain anonymous to that abuser. In other words, to give them an opportunity to not have all of their public information readily available out there because they could still be at risk. And I found that an interesting approach. Tell me a little bit about it. It's a whole section of bills. It
is Senate Bill 70 through 76, and it's to do just that, protect people that are at risk of being hurt or even killed. It could be somebody that had been in the sex trafficking industry. It could be domestic abuse. It could be anyone that's fearful for their life or at least quality of life because somebody's stalking them or trying to hurt them. And we know that we give out those names and addresses readily through the state. And so the first thing we need to do is make sure that we won't do that for those people that have shown that they do need to be protected. And so we did that at the Secretary of State's office. The bill did get stuck, so I'm very fortunate to be back in a different capacity to try to get those through. And these people have no one to lobby for them. They have no one that's really helping them. We're their lobbyists, so it's incumbent upon us as legislators to help people.
If you haven't done this, people really should just sit down at a computer and put in their name and find out how much information is readily available. I mean, there are a lot of ways that you can protect yourself, but you accurately point out that these folks don't have a voice necessarily. And some of those things that you or I would not be able to keep from being accessed by FOIA or other means can now be protected under this legislation, would be protected. So it would mean voter registration. What all would be protected for these folks?
Yes, so most people will have a state ID of some sort, usually a driver's license or just a state ID. They are on the qualified voter file, which is for sale, and it is quite reasonable, under $30, and people do get it for other reasons. It does have names and addresses on it. None of those things would be shared with the people that have been identified that they need to be in this program. This is not an easy program. They will have to move from where they're currently at when people already know that they're there, and they give up everything to try to protect themselves and or their kids.
What do we think in terms of numbers that we're talking about? Maybe it's impossible to know, but how many people out there would this potentially benefit?
We're not sure, but you know, we think if it's anything like some of the other states that have something like this, that we're talking hundreds, maybe 1,000. It's not that large a group, but if you're one of those 800 to 1,000 people and your life's in danger all the time and you live under those kinds of circumstances, never knowing, and especially when you have kids, it means everything.
And where are we in this process?
Well, I'm very pleased to say that it was a bipartisan bill. We had as many Democrats as Republicans that sponsored the bill, and it passed unanimously yesterday, so now it will go over to the House.
When you think about the process, and we were talking about this before we started, and I think it's worth mentioning. Here is a circumstance that is dire for those people that it impacts. Your numbers suggest those numbers are way too big, but as a percentage of the state, still a relatively small group, but yet you get the entire body to support this process. And as I told you earlier, I think we in the media take some responsibility for not pointing out the majority of the bills that pass out of both chambers are bipartisan, aren't they?
They really are. I've never had a bill that I didn't get bipartisan support in the 30 years I've been in office in some capacity, whether it's an idea as a Secretary of State or a bill or a resolution. And the media is not really drawn to that very much. I don't think that's a big story, but I think it's really a much bigger story than all the other ones when we do fight, because we are getting things done. We do work together. We understand protecting people, letting them have an avenue to protect themselves It's nothing to do with party or partisanship. It's just good government.
You talk about protecting people. One of the things I like about this job is I learn things. I don't always like all the things that I learn, and we've been learning over the past couple of years about emerging contaminants, something called PFAS that has been very prevalent in our area and I know elsewhere around the state. And when I walked in here today, I was talking about other initiatives you were working on, and you showed me a map that outlines a contaminant that I hadn't even thought about in a long time, and that's arsenic. But you've been working on this for a long time. You actually have a map that shows in your area, where you're from, it's even heavier than it is in western Michigan, but we certainly have elevated levels there too. And this is something that we've known about and been talking about for a long time.
We have. We've been talking about it too long to not let people know. They deserve to know. When you live in an area that you're on your own well, there's no one that informs you of what's there. There's no law to require that, and no one takes responsibility. We as government have a moral obligation to say, you might want to test your water for these things. They've been found in the aquifer near your home. You might not have it, and here's how to fix it. And it is easy to fix. There's different filters that you can use based on what contaminants you have. One filter does not take care of everything. On my house, I have 3 different filters that take out 3 different items, and one of them is arsenic. And arsenic, we know, can cause some very severe health problems, and they're listed in there. It's not just cancers. We know now that it can hurt the IQ of a young child because it's a heavy metal. We also know that it can cause diabetes and hypertension and heart disease and all the things that they say Michigan has a higher risk of than many other states. It can all be caused from simply drinking water with arsenic in it. It's colorless, odorless, tasteless. We have 25% of us on wells in Michigan, more wells than any other state in the nation, and no one to date has taken any responsibility to inform people what they should test for, except for Washtenaw County has, and I look at them as a model. And actually, where they have their most contaminants, they have their highest real estate because they also have an educational component, how easy it is to fix. And I think that's very important to understand. This isn't going to hurt real estate values. It's just going to have to be an educational component. But to let people drink water for years and not tell them whether it's arsenic or nitrates or volatile organics or PFAS, I think we've done a great injustice to the people of this state by allowing that to happen. And so I worked on it 20 years ago. It was central to why I ran then as well as government accountability. And I'm back for both again.
Well, when you talk, and let me make sure that I heard you. Did you say 25% of the people in the state of Michigan are on wells?
Yes, more than any other state in the nation. And we have 1/5 of the world's fresh water in and around our state. It is the liquid gold. But again, so many people are drinking water and not knowing why they're sick. As a matter of fact, there was a study and a number of different organizations that got involved in trying to train doctors what kinds of symptoms to look for, because it's very expensive, obviously, if you're an insurance company, to have to pay someone to come to a doctor over and over and they can't figure out what it is. And Carmona Cancer Center was involved, and Blue Cross Blue Shield and some others, to make sure the teachers or the doctors were taught what to look for to try to stop this. Now, it kind of got stalled out a little bit because the main person got very ill. He was with Doctors Without Borders, and he got bit by a bug in Africa, and it just put him out of commission for a while. But Dr. Michael Harbutt is the leading guru, I'll call him, of the state of Michigan. There's nothing about this that isn't just pure science, old-fashioned medicine. This isn't some of the nouveau medicine that people sometimes will roll their eyes about. But when they did this study, they knew that long term, and I've lived in the same house since the 70s, and it does have some arsenic in it. It can cause cancer of bladder, lungs, kidney, skin, nasal passages, liver, prostate, neurological problems, hypertension, peripheral vascular disease, diabetes, malignancies. And you can tell from this map that this is where the bulk of the population in Michigan lives. Now, a lot of people are on municipal wells, and they are informed twice a year now by federal law from whoever supplies their water to tell them what's in it. And they also are required to get down below the maximum contaminant level. But we don't have anyone that's telling us about our wells. those of us that are on our own private wells. And that's a problem for me, that I have met a number of people that have gotten sick and they don't know why. And I had a friend that came to me when I was a county commissioner, and she's only about 4'11", and she put one foot one place, one another, which made her a couple inches shorter, and she took her finger into my face. And at first I thought maybe she wasn't quite right. And as I looked into it, I found out she was exactly right. And she took her time going door to door and telling her neighbors, and she would come to me and say, they're really sick, they can't get out of bed, there's all these problems, her husband has prostate cancer, she has this cancer, and this is what's happening. And I said, we can't overgeneralize, there may be other issues. And when she tested their water, it was over 200 parts, which 10 parts is the limit. And even at 10 parts, I wouldn't want to drink it personally, because when the federal government establishes the maximum contaminant levels, there's also maximum contaminant goals. But you can't charge someone, say, $500 for a gallon of water. So it is scientific, but also financial when they give those numbers. So no amount of arsenic is good for you.
So you've got the study. You also know where the arsenic is. You know what it does. Now, what does the state have a responsibility to do from your perspective?
We have a moral obligation, a moral responsibility to let people know what they should be testing their water for. And we may want to do that through the local health departments, but I believe that everyone should receive a piece of mail, just like they do when they have public water, that shows what's on their bill. It could be on a tax bill to save money, it could come straight from the health department, but you should know what you should be testing your water for. You're not going to sit there one day and say, hey hon, maybe we should look up radium and see if it's in our water. It's just not going to happen. And we know that's an issue, or PFAS even, that's a little more public, but certainly nitrates, arsenic, volatile organics, leaking underground storage tanks, all of these things that can cause severe health problems. And what I find most ironic is when I talk to maybe a mom that's got a few young children, she'll say, well, I had my water tested. No, it was tested for just two things, and arsenic wasn't one of them. And she's like, but I boiled the water. Then you're concentrating the arsenic for your kids. And to not let people know, I think, is a huge moral blunder that really impacts people's lives. And so we were able to get $7.5 million into the budget that would have impacted those of us that are on wells. And it's for knowledge, not to pay for the filters. And by the way, the filters have gone way down in cost. I had 5 of them. You only have to do it at the point source where you drink, because I had a building and there was some in that. At my house I have 2, and at a little cottage I have 1. All of them have arsenic, all in southeast Michigan. But as you noted, it's not just there. And it's easy to fix. We just need to let people know you should test for it, and here's how you can fix it. It'd make a lot of people's health a lot better. And I feel really bad for these young moms that I talk to that are actually boiling it and making it worse and really don't know it.